Hello everybody, 恭喜发财，恭喜发财。Welcome to our Facebook Live, last one before Chinese New Year 2022. Okay, 恭喜发财 Happy Chinese New Year to everyone. Welcome back to our live show today. Every Wednesday, 1 p.m. to 2 p.m. is our time here in Revival Clinic. I'm Dr. Jeff here to share more information, knowledge, for your beautiful life, to make you more beautiful, to make you healthier. Yes. So this is our chance here, to answer all your relevant questions to your beauty, to your health. Okay. So we begin with a nice Chinese New Year songs. This is a very nice theme songs this year. Okay, for Chinese New Year, I believe every one of you have heard of this song before. So the feeling, the emotion of Chinese New Year is just around the corner, okay? And our Chinese New Year is just near, roughly about 5 days, or 4 to 5 days, before our Chinese New Year. So are you ready, for your Chinese New Year? Are you busy, finishing all your works, completing all your works, okay, to celebrate your Chinese New Year? So spend some time today, before Chinese New Year. Most of us will consider to beautify a little bit on our face so that we will look younger, more handsome, prettier in front of our relatives, friends, which you have not met for past 2-3 years, right? So this year in 2022, we are considered lucky enough to be able to celebrate our Chinese New Year slightly near back to our normal celebrations method like before. So we can cross country, go back to your hometown. We can home visit. But open house cannot. Okay. So you can home visit. You can celebrate reunion dinners with your families. Okay. So you would like to look prettier, or better looking. So today's our topic here. Would like to discuss about Chinese New Year facelift, talking mainly about fillers and Botox. I believe a lot of you probably heard about filler and Botox, and your first impression is, I do not want filler and Botox. You will feel that, okay, filler and Botox will makes your face looks weird, okay, looks ugly, looks something not natural. Today, I would like to answer all your questions related to filler and Botox and I would like to clarify all your doubts and misunderstanding with filler and Botox. So filler and Botox actually is a very good tool being used in the aesthetic and facelift treatment. But the only thing is it has a lot of misconceptions and misunderstanding regarding this filler and Botox used in the market. So today I would like to clarify. If you are here with us, try to write down, comment, or put up your questions to us so that I can answer your relevant questions which will clear your doubts. A lot of people were sort of like heard about filler and Botox, but they do not dare or even tried it because they do not really fully understand what is filler and Botox. So today I will try to give as detailed information as possible to every one of you so that you will get to know what is the real or proper understanding, proper knowledge which you should know about regarding fillers and Botox treatment available. Okay, so commonly when we are looking for some facelifting to make us look less tired, if you are feeling tired looking, your eye circle, your eye droopy, your laughing line, your face droopy, commonly you may come across when you did consultations to any doctors or you did consultations to any beauty experts, probably filler and Botox is one of the options, but most of the time you do not dare to make decisions and to try all this treatment is because probably you do not really properly understand about filler and Botox. Okay, so let's discuss about filler and Botox today. Okay, first I will begin with this slide shows. Okay, all right, I would like to let you understand one thing is logic thinking is very important. Okay, let's have a logic thinking about filler and Botox. Why are we scared using filler and Botox? Okay, even I browse through YouTube's, Facebook's, all the social medias when I open up any news related to filler and Botox. Definitely, you are right. There are a lot of negatives and a lot of sort of dark side of filler and Botox. A lot of people commented saying that they probably had a bad experience using fillers and Botox causes they have so kind of complications. Okay, so why is this happening and why am I, this Dr. Jeff here, is still talking about filler and Botox if it is really so bad, really so negative about filler and Botox? Logic thinking. Okay, first, everything's is also have its pro and cons. Okay, filler and Botox has its use. Okay, if we do not use it properly, definitely those complications will happen. Okay, if it is using properly, then it has its own advantage. But the thing is, if it is more disadvantage than advantages, then it should not be assisting anymore in the medical aesthetic field. I would say filler and Botox still existing and being commonly used still in the market, is because it is still a very useful tool. But then how can we, let's say you are as a consumer or patients who are going through the filler and Botox, how can you be sure that your filler and Botox are being used by your doctors, that the doctors that you believe in are using it in the correct way? Okay, yeah. So let's have some logic thinking. Today's our discussion mainly are logic thinking, very logic thinking. So if you can get this logic thinking right, whenever you consult a doctors or beauty experts for your facelift purpose, this logic thinking will help you to sort of like filters all the informations given and also all the recommendations. All right. So this logic thinking and better decision makings based on your knowledge. Okay. Yeah. The other way around means if you are anxious to consider about filler and Botox, you are not having any proper knowledge for you to have this logic thinking, right? Okay. So why first logic thinking again? Why are these items created at the beginning? Means why is it filler and Botox in this market? If you browse, check internet, or check some information in history, probably 20 years back, 30 years back, there are no such thing in the market called fillers or Botox. Okay, but why are these items created in the medical field? Some more, it's not like in a kind of certain industry field or certain cosmetic field. No, it's in the medical field. Filler and Botox is considered a medical device or medical items, which is by a lot of supported by a lot of medical research and evidence to prove the efficacy, the use, the purpose, the functions, the indications of usage of using this filler and Botox. So it is a medical sort of like founded kind of items in the market. So why are these items created first, in the place? Why is it created at the first place? The answers here is whenever our face age, there are some conditions happening when, for example, when our facial volume, which is our fat volume lost, okay, then it causes the face aging. So because a human face aging in such a way where we have an obvious volume loss, so to replenish or to rejuvenate our facial aging, to make us less aging looking, we need to have something that can solve the problem, which is the volume loss. So how to solve the volume loss? We need some fillers. Filler is to replace the volume loss. So this is the idea, the reason behind why this item was created at the very beginning. Okay. And how about Botox? Botox is a kind of medical toxin, you can say so, medical toxin called botulinum toxin type A. I repeat, botulinum toxin type A. So Botox is a brand, was the first and earliest original brand, which patented by a company, and the ingredients of it is called botulinum toxin type A. The use of this botulinum toxin type A is to relax our certain overactive muscles on our face. But here properly, this is what I'm trying to say. If you do have some obvious wrinkles causing you looks old or aging, then that is the indications that you can use Botox to treat. The other way around, if I smile, I got wrinkles, but the wrinkles does not causes me to look old or ugly looking or old looking, you do not need to do Botox. You got a point, right? Okay. Botox or botulinum toxin type A is to use to treat and relax certain overactive muscles on your face that causing you looks old. Okay. So botulinum toxin was initially sort of like found, okay, through a bacterial fermentation. It's actually a toxin found, through a Clostridium botulinum bacteria. A kind of bacteria releases this kind of toxin. So this toxin was eventually being used, in medical line to found that it has a function to relax our facial muscles. So this is why the botulinum toxin was very early, on the early stage it was found, then after that being used, after a journey of medical research and medical proof, it was being used, in medical line for certain particular purposes. Okay, so fillers is to replace volume, Botox is to relax some overactive muscles. Okay, so I hope I clarified this clearly. The ingredients of it is completely different. Okay, botulinum toxin, which is the ingredients of the Botox. Fillers is just a name. Okay, filler is just a kind of sort of like explanation, something to fill in the volume. But what is being used to fill up the volume? Okay, commonest use is a kind of cross-link. We call it cross-link hyaluronic acid. Means it's a kind of hyaluronic acid have gone through a technology processes where it cross-link it. When it cross-link it, it actually makes the hyaluronic acid behaves like a gel which is a little bit of viscose texture, then only it works as a volumizing effect. Okay, this is a commonest used fillers ingredients. There are many other kinds of ingredients being used in the market, but at this moment, I would confidently say the safest, most commonly used, most worldwide used material for fillers is hyaluronic acid. Okay, get it right now. Those ingredients, hyaluronic acid, if you found it in products, skincare, facials, or even supplements, those are non-cross-linked. Which hyaluronic acid basically, naturally, it has the water absorption effect to help our skin to get moist if you apply hyaluronic acid moisturizers. But it doesn't work as a filler material. Yeah, sometimes I found it funny. Yeah, patient scared of fillers. Yeah, then they even scared of hyaluronic acids ingredients in skincare because they were afraid that this hyaluronic acid will work as a Botox effect on the face and it cause your face become like this, something like that. Okay, this is most most misunderstanding kind of problems. Okay, so fillers is to replenish some volume. Commonest use is cross-linked hyaluronic acid. Botox is a brand, okay, which originally patented the earliest brand, okay, for botulinum toxin type A. There are many other brands available in the market now, yeah, which also contains the same thing called botulinum toxin type A. All right. So these are the reasons why the fillers and Botox was created at the very beginning, at the first place, to help to solve the problems of our facial aging. Our face age, if it does not have any volume loss or muscles overactivity problems, then no such thing will be needed. No fillers is needed, no Botox is needed. Okay? But when we age, our face will go through a process of volume loss, muscle overactivity. Yeah? But once this volume loss and muscle overactivity become a significant problems, which it makes your face look old, tired, saggy, then you probably need this filler and Botox to do something and improve something on your face so that it makes your face looks young or even maintain in a young condition. Okay, logic thinking. Okay, so how to use it properly? Logic thinking again. Okay, so filler and Botox, of course, it cannot be simply inject on our face. When you inject fillers onto an incorrect place, of course, it will make some problem. If you inject into the blood vessels, it will cause you to have blood vessel blockage, side effects. If you inject into the nerves, it will make your nerve damage. There is a side effect. But if we inject into a proper space, which is the fat tissue, and the fat tissue is exactly the fat layer or the fat volume lost during your aging, then you are doing good because you are replacing the volume that you're supposed to have when you are younger. So that now you don't have the volume anymore, you replace the volume back, then you are maintaining your facial features as in a younger mode. So this is the proper way of using the fillers. Botox also the same. If you have some overactive muscle over here, like this, for example, this is not considered very overactive. It's not causing me to look tired, old. Then you do not need Botox injection. If your wrinkles are very obvious and it causing you a lot of very obvious line, and the lines is causing you a lot of causing you significantly looks old, tired, then you may consider Botox in a proper dosing to inject onto the overactive muscle to relax the muscle. Then it serves the purpose for you to make you look younger, and at the same time it prevent the muscle overactivity problems to get worse over time. Okay, so this is the logic thinking how to use it properly. Okay, next, for your understanding how in my experience we use filler and Botox. Okay, when we assess a facial's problems, okay, if you look at the pictures here on this side, when I point, it's actually this side where I point. Sorry again, Okay, this is where our face, this is how our face looks when we are younger. So bearing this in mind, when our face getting older, it's a kind of dynamic process that go through slowly, a little bit by a little bit, okay, with our age. So as a doctor, we need to be able to capture at what stage your aging has kicked in, at what problems, at what layers your muscles, your fats, your skin has already aged, and is it already a significant aging level? Okay, so this is a comparison like aging, significant aging, and this is no aging, young. So when your facial features has already significant aging that causing you some problems that you look old or aging, then you may need some treatment to rectify the problems, okay, which may be, not must, maybe filler and botox. All right, you get me right? Okay, so this is an underlying structure on our face that a lot of people do not know. Here I would like to let you all understand, ladies and gentlemen, if whenever, let's say, when we as a doctor assess your face and figure out that, okay, you do have, let's say, if you do have some significant volume loss on your face that causes you to look old, then the idea of volume replacement or the suggestion of volume replacement will be needed. Before we recommend fillers, we need to assess at what fat layer or fat spaces you have lost volume, and that fat spaces is, okay, I should say this way. If we do see, let's say, for example, you have some tear trough of sagginess of your eye, and the surrounding area of your eye probably has volume loss, right? So this is a rectified problem, tired looking with volume loss around your eye. Okay, so before we straight away step into fillers recommendation, okay, we need to know which layers and which space of your fat has significantly lost. Hear me properly, is significantly lost. If it is volume loss but not significant, then do not treat it. If it is significantly lost, means we do see obvious sunkening. At the same time, we do see that it causes the surrounding ligaments to be weakened and it contributes to the sagginess problem. Then this is considered significant loss. When we figure out a particular pinpointed, a particular sort of like fat space which has significant loss, then we will need to target those particular lost. Okay, yes. Volume spaces come by. Come back to this picture. Actually, when on our face when we are younger, we have this all 16, on our face there are 16 fat pads, isolate fat pads that actually align on top on our face next to each other, one by one next to each other, and in between all the fat layers there are some septum or ligaments attachment. They are holding up each other. So when we are young, you look at this face, when we are young, our face contour surface are smooth in the very well, sort of like defined contour and line, which we don't have this up and down curvature. So it means that our facial fat volume at every single particular areas are quite adequate amount and full amount, and the surrounding ligaments of the fat is fully supported. Okay, so this is how this facial fat tissue exists in our face since we are young. But the thing is, when we are getting older, okay, this fat tissue will slowly disappear and lost in volume. But the interesting thing is, the volume loss on the fat spaces is not equal everyone. I mean, it's not equally losing on each space. It will be happening in such a way where certain area of fat will lost more and certain area of fat will lost less. So it will become unequal fat volume, and the outcome will cause, the effect of it when we age, when losing volume unequally, it will cause our ligaments on our face to become losing out the overall supports, and it will tends to the gravity pulls, and it will cause the sagginess more obvious. Once the pulling of gravity takes place, then you will see the ligament lines more obvious on your face. Okay. Okay, before I go into further details and further explanations, I think a lot of people, when they talk about fillers, okay, then a lot of confused or even anxious, okay. These are the anxious sort of like questions that always I came across with all the patients, okay. First, you're probably afraid that after filler injection, you will get very swollen, and the swollen will make you weird looking, right? And also, filler, you may scared that after inject, it will shift place, it goes to somewhere else, okay? And this is the most interesting concern that a lot of people have. After they inject fillers, they will be like worse than before. Yeah, worse than before. Meaning to say, after you inject, let's say, assuming the fillers may last maybe 1 year, 2 years, then you may be concerned and anxious or even scared to inject filler, because that you may think, yes, after the filler injected, then after 1 or 2 years when the filler material gone, then your face saggy problem will worse than before. Is it so? Is it really like this? Okay, today I will need to clarify all this misunderstanding properly and make you have this logic thinking or common sense thinking properly. Okay. All right. So filler and Botox, okay, usually is a very confusing words that you will hear about. Okay, so let's talk about filler first. When we look at our face, you see, when we age, these are the significant lines, sunkening, wrinkles, sagginess, folds on our face. But if assuming that you do not analyze the fat pad and ligaments properly, and just assuming that you take filler material and just trying to see from the surface and try to just inject onto the hole and try to fill up something, the risk of injecting why you will have this about swelling. Okay, swelling usually occurs when you, let's say it's not you lah, maybe the injectors, do not properly assess the fat tissue and the ligaments before the injection. Meaning to say, they just take up the fillers, and when they look at your face or got sunkening here, then they inject lor. Got holes here, then they inject lor. Got folds here, then they inject lor. So when you do such a way, there's a very high chance that you do not know how much to inject, and you will tend to over inject to try to fill up the sunkening, so that you will see the result immediately. But the thing is, in such a way, you will probably also over injected onto a space, and then you will definitely have some risk of swelling afterward. Same thing, if you inject improperly, okay, meaning to say, if you just take a fillers and inject, probably your injection technique is correct, okay, but the thing is, you do not calculate accurately the volume amount needed. So probably when you inject, let's say a sunkening here, you inject, then you try to make the improvement by slightly injected, accordingly until the sunkening area sort of like filled up. So in such a way, there is a high chance that you probably overloaded onto the ligament on the surrounding. Meaning to say that the space itself is so small, when you inject, you try to fill up the sunkening, but then it overstretch the ligaments at the surrounding. So it will make you to look swelling, at the same time you look weird, and unnatural. Okay, so this is part of the questions that asked by the audience. Will it cause unnatural? The answer is if you do not plan properly, you will probably inject or over inject on one space. But the understanding is our facial volume loss. We need to inject, yes, correct. But we need to plan. We need to plan properly at what space you lost how much of volume. Then we need to carry out all the plan, sort of volume accordingly, correctly. We cannot just do it intuitively by just sensing it. Cannot. Okay. So if you over inject and stretch the ligaments and surrounding sort of like ligaments, yes, the filler may shift place very easily. Because it's highly pressured at one area. And in such a way, it will definitely cause you to become worsen because your ligament overstretched over at least 1 year or 2 years whenever the filler still remain, then it will cause you to become more saggy at one particular area. Then after your fillers material goes off, that particular area will become more loose than before, right? And this is why you will feel that this kind of side effects is happening. So I'm telling all to you is actually trying to let you understand whatever you see on the internet and social media, which is correct. But the thing is, if those correct those complications was happen basically because of not properly planned fillers treatment. Okay, let me introduce you how to do filler treatment in a proper plan. Okay, to target our aging correctly, precisely, to improve your aging problem in the best way and avoiding all these kind of side effects completely. How to achieve? Okay, so let's say look at the face here. Okay, we do see some tired looking with this ligament folds, the laughing lines, the sagginess of your cheek. Okay, so these are the related. Okay, goes back. Relates this picture and this picture again. So whenever we notice a face with this kind of sagginess, when we do the analysis, we will be able to pinpoint which area of fats, like just now the case, which most likely the temples has lost volume at least 0.5 cc's of volume. Okay, why I can say so? Because these are all medical proven evidence-based volume that already being studied in thousands, even 100,000s or millions of people on the volume. There are a lot of medical research has already done on our face volume and each particular fat pass, how much of volume we have and how much of volume lost. It already happens before it causes sagginess or folds or lines or sort of like cheek sagginess. These are already being proven. So when we plan a treatment to target your problems, let's say a sagginess of your cheek and sagginess of your tired eye, then we will know that your temple needs, okay, how many volume, okay, estimated usually 0.5 to 0.7, okay, depends on the sunkening, depends on the droopiness of your eyelid and also your supports over your eye corner. That will determine 0.5 or 0.7 cc's of volume. Okay, and of course the material chosen is also important. Okay, so today I'm not going to go very detailed talking about material choosing, but will be more on how to properly plan the fillers, okay, in terms of volume and in terms of precise location to inject fillers. This is a very crucial steps to do before you step in any filler injections decisions. Ladies and gentlemen, up to now, if you still cannot catch my idea right, I try to make it simple for you. Means next time, whenever a person recommending you a fillers injection, make sure you do have a very clear mindset or understanding at which area, particular point you do need how much of volume needed to inject, and in the properly planned and steps wise, then you will be able to justify whether will it solve your problems or not. Okay. So, for example, a temper around 0.5 to 0.7 cc's, on our side of our cheeks 0.2 to 0.3 cc's, and on our lower cheeks here we need about 0.5 to even 1 cc some more, 1 cc sometime, and also under the eye we will need sometimes 0.5 to even 1 cc's. So you see the variants are so huge, so wide. how can one treatment fit everyone? Cannot. It must be planned accordingly to each individual, and each individual is special and different. So everyone has almost similar characters of anatomy or structure, but the aging characters and the changes on the aging on the face is different every individual to different individual. So this is the thing we need to customize, we need to check, we need to analyze before any fillers injection can be done, so that it can prevent all these side effects and it can deliver a good improvement, to improve your eye, to improve your sagginess, your aging issue, even like this kind of ladies, at their early mid-age, probably early 30s, you probably say this girl still looks young, do not need any treatment. But if you look close, or maybe my professional eyes, I do see some aging characters already kicking in on her face, and there is some areas she already have some volume discrepancy, and some area has some sagginess, and some area has already some volume loss, and also there is some area that she already probably born with lesser volume on the face, which makes her more tense or more tendency to age on that particular area on the face. Okay, I can't tell you, okay, because you do not understand one. Okay, I can only sort of like whenever you want to do filler, for example, like these ladies, the analysis on her will precisely pinpoint which area of fats that she needs and which area of fat they correctly is to say which area of fat she needs, and then how much of volume that she needs to maintain her facial looks in the young mood. Okay, very important. So after the injection will make her look younger, maintain in her younger look, and prevent the aging further. Okay, yeah. So this is a characters when volume loss significantly. Okay, come on, hello, you tell me, is this volume loss? A lot of people may assume that, oh, these ladies on the picture is not having volume loss, it's like having over volume. Are you sure? Are you sure? The answer is these ladies do have significant volume loss, and discrepancy of volume causes her to have significant, laughing line, folds here, sagginess of her cheek, because she has a significant volume loss over her temple, over her side of her cheek, side of the buccal area, and also the jawline, and also her chin and laughing area and lips. This causes her to have a very droopy face, and this is the very considered a very good candidate with filler injection can improve her significantly. Okay, but you do not understand, right? So fillers, actually, if you would like to discuss, it can take up maybe even many days. Today's the most important thing I would like everyone of you who attended this live is try to understand. Okay, fillers injection is safe if you do it properly. And what is the proper method? The proper method is, the answer here is proper assessment of all the fat volume, and to determine each area of fat volume loss needed. Okay, and a proper precise injection of filler will be the most important things to decide. Any downtime from filler treatment since CNY next week? Okay, Judy Tan is asking. Okay, I will advise any filler injection, at least give it like 3 to 5 days for some downtimes, like mouth swelling, some mouth bruises. Okay, it's not definitely will have bruises, but mouth bruises will happen, mouth swelling or mouth discomfort, at least 3 to 5 days. Okay, so today is Wednesday, Chinese New Year is by about next Monday or Tuesday, so still possible to do it by this 1 or 2 days if you are keen to. Okay, so these are about fillers. Okay, how about Botox? A lot of people still, when I mentioned in my experience, when I talk about Botox just for information only, they will already like step back. Oh no, I don't like Botox. Okay, so I found it a little bit sort of like needful for understanding. Okay, Judy Tan interrupt me. Okay, I still managed to do before Chinese New Year. Of course, Judy, can, why not? Yeah. Okay, so come back to my slides. Okay, Botox is, as I mentioned earlier on during my earlier presentations. So Botox is a kind of botulinum toxin. It's a medical-based botulinum toxin, safe to be used for overactive muscles activity on our face that causes us to look old. Okay, so actually the idea is the same about like fillers. When our face age, our face lost volume. Okay, when the volume lost, it causes the surrounding ligaments that support the fat volume to become loose, right? So when this happens, at the same time also our facial muscles will be moving more actively because the facial volume loss causes the ligament to lose the support and the overall spaces are moving more easily. So this more easier movement will make the muscle to tends to hold up stronger tone, then the activity of muscle will become stronger. So in this condition, okay, our face will slowly generate some wrinkles, like frowning, forehead line, crossfade, or wrinkles overall on our face. So that is when our Botox needs is considered. The line is a bit slow here. Okay. She's supposed some Okay, some lines issue. Sorry. Okay. So you see, I try to make it simple to you. Okay, whenever we have a kind of wrinkles, obviously causes us to have this aging looking on the face. Okay, then the role of Botox is there. Okay, so the Botox is not scary. Okay, the only thing you need to make sure and common sense thinking is you must make sure that you are really treating some significant impactful things, which is the wrinkles that causing you problem. If the wrinkle is not causing you problems, you may consider do not need to treat it. Okay, and if you are having a very obvious significant wrinkles, you want to consider Botox injection, yes, you can go ahead and it is safe to do. In a proper measured dosing of Botox injection, it will be perfectly safe. Okay, of course, try to keep your expectation correct. Wrinkles injection with Botox is to lighten it. If you inject until it become completely gone, then you are freezing the whole muscles, and definitely you will be feeling very tight and very weird looking, and you can't even do any facial expressions in such a way, and then you complain saying that Botox causing you to have frozen face. Then this is something, it happens because the injection dose was too high. So basically, the injection dose should be used accordingly on your wrinkles or the muscles activity, so that it's just enough to relax the muscles, but it still preserve the certain amount of the function of the facial muscles for the purpose of facial emotions or expressions. Correct? Okay. So this is a proper tannings of Botox injection. Okay, same goes to this picture. If you look at the eye, probably some wrinkles around the eyes, we call it cross fits, or some frowning line here, probably causes her to lose a bit old on her age. Then she can consider some Botox to target here, straight to the point. Okay, yes, and just relax the muscles and make her able to smile. Okay, in a nicer way and not so old looking, and which is already served a good purpose. Okay, yeah, if you are having this kind of wrinkles as in this young lady, I would recommend you do not need to treat. Why? Because this is a normal wrinkles for everyone. I also have. But if you do not have a significant static lines, means even though you don't do any facial expression, then you have wrinkles, then something wrong. Probably your wrinkles are very obvious and your muscles are very hyperactive. And if you are moving and doing this expression, surprised looking, then you have some folds. This is normal. Like this young lady, she has this forehead wrinkles when she looks surprised. That's perfectly all right? Yeah. Unless comparing to this older middle-aged gentleman who has this obvious wrinkles, whenever he frowns or doing his facial expressions, the wrinkles makes her really looks old. Okay, and then some lightening of the wrinkles by using Botox is indicated. Yeah, this is the effect. Yeah, for this indication. For example, on this face, a young lady here, but with these wrinkles, she looks old on her age. Yeah, and after Botox injection, it makes her looks fresh. Yeah, makes her looks younger, more attractive. Yes, and same goes to this. Okay, if it is in the older age person, the wrinkles makes her looks really old, really tired looking. Yeah, so after Botox injection, it makes her looks better. Yeah, younger looking. Yeah, why not? Okay. Yeah, the benefits of Botox not only on that particular short-term period of improvement, but it also prevents your muscles of overactivity to become worse over time. So this is the long-term outcome or long-term benefits. Okay. So again, for Botox, there are also a lot of side effects that people scared of. Yeah. Same goes to my fillers explanation just now. Botox side effects is also actually created. Okay, and you see those side effects is when we improperly use and not properly using the instrument or the tools. Filler and Botox was invented or even created at the first place for the needs of aging, but it needs to be used very properly. Yeah, of course, if somebody use it improperly, then it will cause the frozen face when you over inject the dosing. Then you can't even smile, and then you probably over inject and sort of like usually it won't get cost dependent unless fillers. Yeah, you over inject and overstretch the ligament, it causes certain area of the face to sag even worse or more than even sag more than before. Then it's something improper. Okay, or toxic. Is it a Botox a toxic to the body or cause cancers or some sort of like any kind of chemicals toxic in the body causing a sort of like unhealthy problems? No, it's not. If it is already listed down in the medication or in the prescription or in the box. Yeah, it is not. Okay. So, or look like lion face or looks like a weird face. This is not due to Botox. A lot of people misunderstand. Look like lion face is definitely like this. Is due to fillers, and the filler is over injected due to improper use of the fillers. If it is a proper use of fillers, it will not cause you to have this. Yeah, it will cause you to have this. Okay, not like this. Okay, so to have younger look and natural look. Okay, so these are the things I would like to share with all of you. Okay, so I hope when you are looking for a treatment during a Chinese New Year to facelift to make yourself looks prettier, younger looking, or looks better. Okay, yeah, I hope this explanation here about filler and Botox will give you a proper knowledge. And I always believe proper knowledge is very, very important for everyone. Yeah, regardless for whether you are looking for your beauty, even for your skin care, for your facial improvement, or for your health, or for your overall for your lives. Proper knowledge is very important. Get a proper knowledge, then you will be able to have the logic thinking ability to help you. Whenever you come across this kind of treatments, if you are in need of this kind of treatment, at least with proper knowledge, you will be able to justify whether it is a suitable treatment for you or not, or is it a suitable decision for you or not. All right. So I hope, today I bring out this topic, and I hope that I can deliver a proper knowledge to every one of you. And thank you, every one of you who have written down their questions on the comment side. And if you do have any further questions you would like to clarify, you can always PMs, WhatsApp, or contact us. Or if you would like to look for a in-person consultations through online or even offline in-person consultation, you can always contact us, and we will always get back to you. And we are always happy, more than happy to help you to solve your problem. Okay. So by here, I would like to announce that next Wednesday is on our Chinese New Year. So our Facebook Live will stop and off one day. Then the next subsequent week, we will resume our Facebook Live again. Okay. So if you miss us and you would like to know more about anything about aesthetics or beauty or even for your health, you can always pass us a message or text us a message and give us a feedback. Okay. And by here, I wish every one of you Kong Si Fa Chai, happy Chinese New Year, and wish every one of you stay healthy, pretty, and having a good life all the while. Okay. Thank you very much, and see you again in next year. Thank you.